Hello y'all, this is Sets with Sheev. Welcome to another video. And today I want to talk about nursing and the fact that nurses do not need to, or if you know that you do not really have a passion for the career or for patients, you don't really have love for what you're doing and you're only doing it for the money. We need to stop this, okay? And please, if you're new to my channel, go ahead and subscribe, join the community, leave your comments, like the video, share, and all of that, okay? And let's get to this, okay? Because this is happening too much, especially in the African community, the Nigerian community, and which is what I'm a part of. You know, this is happening way too much. You know, they're pushing their kids, go be a nurse. There's money in it. There are other ways that you can make money in America apart from being a nurse. I left nursing in 2020. Okay, right before the pandemic. I was working in a home health agency, and you know, I was just tired of it. I was just tired of nursing. I've tried the whole skilled care facility. I tried doing one-on-one, I tried doing home health, and I just realized that I just didn't want to be, that just was not the way that I wanted to help people. And I have family members who are in healthcare, doctors, and my mother became a nurse about over 10 years ago, even though she was a school teacher most of her life. So I understand, okay? I'm still a registered nurse. My license is still active. I just do not use it, okay? And the reason why is for the reasons that I am telling you. I did not have a passion for this thing, you know? And a lot of people are doing this thing. They're becoming a nurse because they feel like there's money in it. Yes, there's money to be made, but you have to understand and you have to prioritize, you know, because for me, it was not worth selling my soul. You know, it was not worth selling my soul. You know, it was not worth prostituting my soul for money. You know, and if you really look at it, a lot of times you have nurses working 12-hour, 16-hour shifts. You know, they're always asking you, do you want to stay over? Do you want to stay over? And I always say no. The 8 hours that I did is enough. You know? And even the 8 hours that I did, I barely got through it. You know, and I feel like a lot of the skilled care facilities, and I've seen this time and time again because I've worked in a lot of them in my community. A lot of the skilled care facilities, a lot of the nursing homes, the long-term care facilities, they overwork their nurses. A lot of times you're doing nights, and I've worked just about every shift, okay? And the night shift, you have about maybe 60 patients on the floor and only one nurse, you know? And that nurse has to give medications to everybody. And people think that all patients are sleeping in the night. They're not. So they think that that's the easiest shift, you know? But a lot of times you have to give PRN pain medications to these patients, okay? And I feel that, you know, because of the understaffing, a lot of these agencies, they want to, or a lot of these facilities, they want to save money by understaffing, overworking the nurses. A lot of times the staff to patient ratio is just like completely ridiculous. You know, it's not enough people that are working compared to the amount of patients that need care. You know, so this puts people at risk for medication errors, okay? Medication errors, okay? And when you're dealing with critical medications, you know, right now, like they have systems in place whereby the nurses are able to type up the medications and get the names, you know, get it ordered, you know, well, not get it, the doctor's the one that orders it, but get it filled with the pharmacy. And what actually made me decide to go ahead and put out this video, because I was watching the TikTok video whereby they was saying that there was a patient that was at the hospital. I think it was like an ICU, because the patient had some kind of like fluid or something in your brain or something like that, you know. But they were like in critical or at least semi-critical condition, and they were being prepared for surgery, okay? And the doctor prescribed something for, I don't know if it was like for sleepiness, but it was something like kind of like, I guess, minor compared to just the kind of like a minor treatment before the major treatment, you know. And the doctor prescribed it, and I believe the medication started with like a V, you know. But so the nurse typed up, went and typed up. So after the doctor ordered the medication, the nurse went into the system and then typed up the medication and put the V, you know, and it came out to be another medication that started with V. But this one causes like complete paralysis. Okay, long story short, the nurse ordered that medication with a dose of what the doctor ordered, but it was the wrong medication. The patient dies. You know, paralysis, the patient is gone, okay? And, you know, and I strongly believe, I don't know this particular situation of what the nurse, you know, was going through or whatever the situation is, but I can definitely empathize with the family. But I can say, you know, that a lot of these facilities, you know, have to be called into accountability as well, you know, because I've seen so many things during my time of working as a nurse, you know, all kinds of things, you know, from supply shortage, having to borrow supplies, to staff shortage, having like a CNA for like, you know, only one CNA for so many rooms, and some of those rooms, the patients have C. diff, you know, they're having like diarrhea like constantly, and the CNAs having to go back and forth. It's just like, to me, it's like a disaster waiting to happen. You know, and it's like I saw this from a mile away. I left nursing to go back to doing delivery. I left nursing to going back to doing braids. You know, I left nursing, you know, and during that time, my family was basically looking at me like I was a fool. I was stupid, okay? I was dumb for deciding to live healthcare altogether. But you have to know your own capacity. You have to know what you can handle, okay? And, you know, and I left out of like the whole skilled care facilities and all that, and I went to home health, and it still wasn't good. It still wasn't good. You know, it still wasn't good. I was working for several different home health agencies, and it was still the same. It just, you could say maybe I didn't have the passion for it, or there were other factors that were in it, okay? But I was still seeing a lot of things that I did not like, okay? And I started really seeing healthcare as a way, you know, for these people just to make money. You know, it was looking like the condition or the like what happened to the nurse that did not even come into play, you know. So it just was looking crazy to me, you know. And I was seeing it, especially when I went to the home health. I was seeing the patients as if it was like when I would ask, like, okay, well, I'm, you know, like let's say my visits were scheduled for like twice a week, you know, or, and I would call the patients maybe the day before, or, you know, and let them know, or, okay, this day, you know, that we're scheduled, I mean, I'm supposed to come in there to check your vitals and whatnot for this time. And I was just seeing like, you know, it was seeming as if like they were acting as if I was doing them a favor, you know. So that was my own observations and things. And it just like, it just wasn't cutting it for me. It just wasn't cutting it for me. A lot of the things that I was seeing, even with the agencies, it was not cutting it for me. But I digress. If you know that you don't have a passion for nursing, if you know you're only doing it for the money, you're taking shift after shift, overtime after overtime, working 16-hour shifts to make ends meet, you know, to make your money, to pay your mortgage. And you have to understand that you are placing people's lives at risk. You know, you have to understand that it comes at a time that you have to draw the line in the sand and say, is this thing what is best for me? Am I doing the right thing? You know, because at the end of the day, you know, you have to go to sleep at night, you know, and because a lot of times, like when I would lay down and I would review the day when I was in nursing, I would have anxiety, you know, like, did I drop the ball somewhere? You know, did I forget anybody's medication? You know, did I not do this and do that? Did I not do that? And to me, it was just not worth it for my mental health. It was just not worth it for my mental health. You know, so when you have a place that is understaffed, the workers are overwhelmed, they're overworked, you know, and one thing I also saw was the stress. Every single 15, 5, 10 minutes, people are taking smoke breaks. These are healthcare workers that are supposed to be helping to guide patients, you know, into not smoking, living healthier lives. And every one of them is like going for smoke breaks. You know, they are overstressed and they're unhealthy. You know, the nurses themselves I was seeing were unhealthy. You know, and I saw myself thinking like, and they're telling you, and I was relatively new in the nursing, and I was seeing like, is this where I'm gonna find myself 5, 10 years from now? God forbid, you know? So I had to scratch out and block out what any family member had to say about me leaving nursing and going to do what I loved, what would give me more peace of mind, even though it was paying half of what I was making as a nurse, but at least I had my peace of mind. I had my children were really young then, and they're all teenagers now. And I honestly can say that I made the right decision. Okay. I made the right decision to leave nursing, to leave healthcare, you know, because I don't even think that I would still be here. I probably would have been in a psych ward or something, or dead if I decided to stay in nursing, because my mental health and my physical health was going down and going down fast. As a matter of fact, it was one of the days that I was coming back from doing a night shift that I was sleeping, that I was literally sleeping and dreaming while driving, and I crashed into like an embankment, you know, and thank God nothing happened to me, you know, but the car that I was using at that time was affected. It was damaged, you know, so I feel like I'm in the best position to put out this video, you know, and it's not my normal content. I know we talk about narcissistic abuse, you know, but this is also related because a lot of times with nursing, I saw a lot of cutthroatness, you know, in the workplace, because the nurses are, you know, just tired, overwhelmed, you know, and there's a lot of cattiness, you know, a lot of dog eat dog type thing going on in the, so very narcissistic workplace. Everybody's trying to blame everybody else. No, you should have asked the last nurse, and nobody wants to take accountability. It is just like, it was just a hot mess, okay? And I just didn't want to be part of it. I didn't want to. I'd rather do DoorDash. I'd rather do delivery. I'd rather do people's hair. I'd rather find other forms of business and other forms of making money than to be a nurse. But I'm here to say, if you're watching this video and you're nursing, and you see your health going down, you see your mental health going down, you see all the writings on the wall with your work environment, I say leave, because now they're arresting people. Now people's lives are in jeopardy, okay? Now things are going down, and they're going downhill fast. So just know where you stand, and make your choices, okay? And people need to start pushing, especially in the African community, in the Nigerian community. They need to start pushing their children to do, especially for nursing, because they feel like there's money in it. Go be a nurse. They pay them. No, there are other ways that you can get paid without putting your life and the life of others at risk, including your mental health as well, and your freedom. Because potentially, if you're overworked and you're doing things for the wrong reason, you might get arrested, okay? So there's a whole lot, okay, in this topic. But I just felt the need to talk about it, okay? So think about it. If you're doing this thing for money, nursing is the wrong profession all the way, So just think about it. And if you love what you do and you're a nurse, great for you, but I've watched videos I watched a video some time ago. This lady was saying that she left nursing to become a lash tech, and she's making her money, and she would not change it for the world because her mental health was going down. I've seen so many things, and God can bless you in so many other ways, and stop putting yourself in a box that you have to be a certain way or do a certain thing in order for you to make money, okay? God can bless you in so many other ways. There are so many businesses that you can start. You can start a YouTube channel. You can have multiple sources of income. You can do delivery. You can become a lash tech. You can do anything else, But when you have a work or a career or job like nursing, and it's tied to people's lives, this is not something that you want to be playing with, okay? So leave your comments, like the video, share. I hope I enlightened somebody. I just wanted to pour my heart out and just say what I felt. That is what this platform is for, okay? And hopefully I encouraged somebody. Hopefully I deterred somebody that was, hoping for, to do this for the wrong reasons. Either way, I just want to make an impact, okay? I hope you learned something from this video. Like, subscribe, share, leave your comments. Liking it shares it to to more people, and the more people get this, the more people are saved. Bottom line, okay? Because you wouldn't want your family member being cared for by someone that is only doing it for the money, or someone that is overworked, or and like I said, the facilities as well, they have to be called into account, okay? Because it's a whole hot mess, all right? But if you're a nurse, you're doing a good job, and you are making sure that you're taking everything into account in terms of your health, and not overworking yourself, and doing the best that you can so that you're taking everything else into accountability, then God bless you. Keep doing what you're doing, okay? Because we need more people like you. But if you know you're not passionate about this thing and you're only doing it for the money, please stay away, okay? Because too much is at stake, okay? Way too much is at stake. All right. Thanks again for watching. Subscribe so that you can get notified anytime I put out content. Like the video, share, leave your comments. Until next time, God bless. Happy Sunday and peace. And happy holidays.